Welcome to another episode of TOVA Tuesday here where we talk about all health matters to help you live a life of optimal health and wellness. Today, I have on TOVA Tuesday, Dr. Raymisha Gregory. She is a pharmacist, and I wanted to bring her on to talk about what a pharmacist does and how a pharmacist can be your best friend, or at least a member of your healthcare team. So without further ado, I want to introduce Dr. Raymisha Gregory. How are you today?
Hello, thank you for having me. I'm wonderful. How are you doing?
I'm doing fantastic. And let me tell you that when I go to the pharmacy, the first question I always ask is to the pharmacist, what should I take? If I need an over-the-counter cold medicine, which one should I take? I mean, they have such a wealth of knowledge, and I don't think people realize all of the health information that a pharmacist can provide to you. Most people just think that they're there to just fill prescriptions, and that's far from the truth. Is that correct?
That is definitely correct. A pharmacist is a great resource, especially if you don't have time to get to the doctor, especially if you're trying to decide, do I need to see a doctor about this or not? A pharmacist can make great recommendations of things to take over the counter. Some of the old school pharmacists can even help you out with some old school home remedies.
Mm-hmm.
So and if they are new pharmacists, they also have references at their disposal. So yes, that's a great place to start. If you have a question about your health and you're unable to get to the doctor to make that appointment, or even if you have an appointment, but it's so far in the future, you want to get some advice right then and there.
Thank you so much for that. Like I said, I've always, asked the pharmacist millions of questions, but I just, think that you guys do such a wonderful job in educating the community about the medications, side effects of medications, even, what to take, what blood pressure cuff to get if you have high blood pressure and your doctor wants you to monitor your blood pressure readings. So, but I wanted to just talk a little bit about you yourself, because you also grew up in Wilmington. You went to Ursuline. You graduated from Hampton University with a PharmD degree. So I wanted just to bring up your lovely picture. Can you see that, Raymisha?
I can see it.
So tell me, like, what education or training you need to become a pharmacist?
A lot of pharmacists do a 4-year bachelor's degree and then go on to pharmacy school, which now the only degree you can get is a doctorate degree. There are several programs that have a combined program. So you would start undergrad pre-pharmacy, you would do 2 years there, and then a 4-year doctorate program. I kind of did a hybrid of those two. I went 3 years and got all of my prerequisites for pharmacy school, and then I just applied to pharmacy school. I didn't take that extra year to get a bachelor's degree. So right now, the only degree you can get in pharmacy is a doctorate degree. Previously, they did have master's, and I think they even had maybe a bachelor's degree before, but now the field has become inundated. As before there was a shortage, but now there's just so many pharmacists out there. So, but the only degree that the new pharmacists coming out have are doctor's degree.
So you are a doctor of pharmacy science?
That's right.
Awesome.
That's right.
So what made you want to become a pharmacist?
Well, I loved helping people, and a natural fit, especially in my family. We have a lot of nurses in my family. So nursing was I kind of juggled that a little, but I was not a hands-on type of person. I'm not one that likes to touch other people.
Don't touch blood.
I don't have a problem with gory blood and all that, but I don't really like being hands-on. So pharmacy, and actually I considered being a mortician before that.
That's on the other side of the spectrum, like one spectrum to the other.
Yes. So, taking care of people's loved ones once they had passed on. But I think I found a nice middle ground in pharmacy. I was able to be a part of the healthcare team, but not having to actually physically touch the patients. So I think it was a nice fit for me. Anyone who's thinking about wanting to get into healthcare but doesn't necessarily want to have that hands-on experience, I think pharmacy is a great fit. You get to learn a lot about disease states and management of those disease states, and a lot about medications.
Wow, it seems like a very intense program because you have to kind of get a holistic perspective of medicine, not just prescribing pills, but the pathophysiology of chronic conditions as well, I would assume.
Yep, anatomy, physiology. Yeah, that it is intense, but it's well worth it. And you want to be knowledgeable about the medications you're dispensing, and also the effects that they have in the body, and also the different organ systems in the body and how they work together. So it is a rigorous program, but it is well worth it.
Thank you. So a little bit about Dr. Gregory is that she loves traveling to Disney World, and she is a huge Eagles fan, and she loves spending time with her family and friends. May I say I'm a Pittsburgh Steelers fan, so we're kind of rivals here, but we can make do. So I wanted to ask you, so what is a pharmacist? So we talked about that a pharmacist doesn't just fill prescriptions. So tell me about all of the roles that a pharmacist can do.
Oh, there are a lot of roles actually in dealing with medication. So you may have a pharmacist that is on a healthcare team in a hospital, and they may do rotations with the doctors and the nutritionists, the physical therapist, whoever's on that team in the hospital system. They may go on rounds with the doctors. They may work in the inpatient pharmacy, dispensing the medication. And that includes IVs, it includes compounds, it includes TPN, total parenteral nutrition. So patients that are not getting any food by mouth, they need a supplement that they receive, and that's compounded in the pharmacy, as well as chemotherapy medication. So pharmacists are involved with almost everything you put in your body in a hospital setting. There are also pharmacists that dispense medications to long-term healthcare facilities. So any facility where you have patients that are residents, so rehab, assisted living facilities, pharmacists could be involved. In the long-term healthcare, there are also pharmacists that are clinical pharmacists or consulting pharmacists, and they go in and they review the charts and make recommendations. They also kind of monitor how the drugs are being kept and stored, and work alongside with the nurses in a rehab or long-term care facility. And then you have pharmacists that do research, and they help to develop medications, and they are instrumental in trials to develop medications and make sure that they're safe and that they're effective. And then you have pharmacists that work in insurance. So if you go to the retail pharmacy, and everyone knows that pharmacist, that's the face of pharmacy.
Yeah, the one you yell at when you can't afford your medication, right?
That's right. So that pharmacist may tell you, oh, your insurance didn't cover this. You need to contact your doctor, and they'll have to contact the insurance company. And when the doctor contacts the insurance company to say, my patient needs this medication because of XYZ, there's a pharmacist on the insurance team that reviews that claim and helps to decide, okay, we need to approve this medication for this patient because of XYZ, as the doctor has stated. Or the pharmacist may say, okay, because of XYZ, we think this would be a better fit for your patient. So it's all part of a care team and a care system. But like I said, I think everyone knows pharmacy and pharmacists as that retail pharmacist, the one that is up front, and I guess you'd say on the front lines.
Uh-huh.
That's the one that they would ask their questions about cough, cold, and flu season, about nutrition, and like you were saying, blood pressure or diabetes. That's who you would go to and have your day-to-day interaction with. That's who's taken so long to fill your prescription when all they have to do is slap a label on it.
You're right.
But reviewing the medication with what you currently are already taking and making sure it's safe. They're submitting it to your insurance to make sure that even though you're paying that high copay, that it's not even higher. So,
wow, it just seems like it's such a broad area that of different services that you provide to healthcare, to insurance, to long-term care. So a pharmacist is just not in retail. So is that correct to say?
Absolutely.
Wow. So thank you for that. But I wanted to talk about, as a advanced practice nurse, I'm always calling the pharmacists. They're like my best friend. I mean, I have a couple of them that I hit on my phone constantly if I have a question about a medication. But pharmacists can advise patients about their medications, how to use them, and their side effects. Is there anything else that you could provide to patients?
And the retail pharmacists are just going to loathe me for saying this, but retail pharmacists, they are frontline, and they do have a wealth of knowledge. Unfortunately, right now, they are overworked and understaffed. But I would say if you really need help, schedule an appointment with them.
I didn't know you could do that.
Absolutely. I mean, I'll say that it's not normal practice, and not every pharmacist will be willing to do it. But that's a great way. You schedule appointments to get flu vaccines. So I would schedule an appointment. If you really want to sit down with your pharmacist and go over your medications, a lot of the retail chains do offer medication therapy management, where a pharmacist, and most of the time it's not a pharmacist that works in the store. Sometimes it is, but a pharmacist will go over all of the medications that you have. And when I say all the medications that you have, it's all the medications that they fill. So if you have medications that you're taking over the counter, or if you have medications that I fill this medication at a different pharmacy because on Tuesdays I'm over, this side of town and it's more convenient. They're not going to know that or see that. So what they can review is what they have in their system and what you're filling at their store. So they can review that medication for you and make recommendations. But when you're speaking to a pharmacist, and if you do want that thorough review of your medications, you would also have to let them know if you're taking anything over the counter, if you're having anything filled at a different pharmacy, if you're taking any herbal supplements, even if it's something that you take every now and again. I don't even take this more than once a week. Let them know. They need to know because it may affect your care.
Right.
But also, sorry, that's just the medication therapy review. Pharmacists can help you, as you were referring to earlier, pick out the right blood pressure machine for them. There are a lot of products out there. So not just blood pressure machines, but maybe you want a supplement, a nutritional supplement, and you're diabetic. They can steer you, in the right direction for that. Maybe it's on how to use your diabetes supplies. There's a lot of options out there for monitoring your blood sugar right now, and a lot of components that come with it, lancets and test strips and blood glucose monitoring systems. So when they have time, if they can make time for you, they're a great wealth of knowledge, even for medications that you're just starting to take, new medications to you. There may be something as simple as you need to take this with a fatty meal, or you need to take this on an empty stomach. The correct way to use an inhaler, because a lot of times people
That's a good point.
have dire health situations that don't necessarily need to be. Sometimes they're going back to the doctor and their medications are being increased because they're not using what they have properly. So they end up being over medicated, or the strength that they're on is really too high for them. But because they're not taking it properly, they end up, the doctor, we have to get this under control. So they're increasing their dose. They're adding another medication, when sometimes it's just how you're taking the medication or how you're using the device.
Wow, thank you for that. But would it be fair to say that it's advisable to get all of your medications filled at one pharmacy, so that if you are on a large amount of medications, or you have more than 3 medications, the pharmacist can make sure that there's no drug-to-drug interactions? But if you went across town to get one prescription and across town to get a prescription from another pharmacy, maybe they wouldn't be able to see that?
Absolutely. They call it polypharmacy, where people use several different pharmacies because most of the time it's cost driven. And
Yes.
well, that's completely understandable. So people go to different pharmacies to get the best price and the best rate. However, it can be dangerous, especially because you don't always get all of your medications from the same doctor. So what ends up happening is you may have a cardiologist prescribing something. You may have an endocrinologist. Am I saying that correctly?
Yes.
Prescribing other medications. You may have your primary care physician prescribing medication, and some of that may overlap. And a great way to catch that is at the pharmacy. So if you're getting medication filled at different pharmacies, one pharmacist at one store cannot see what is being filled at the other. So it is very important that you stick to one pharmacy. And most pharmacies now will price match. So if the cost is what's driving it, I would definitely, and when you're making a change and switching over, sometimes you do have to consider the timing. And it's worth going in and talking to your pharmacist, especially if it's your main pharmacy and you kind of have a good, even if it's a waiving relationship with your pharmacist, to just take a minute and talk to them and explain, this is what I'm doing and this is why, and could you find a price match for me, or could you help me with finding maybe a cheaper substitute so that my medication can be affordable.
Wow, I didn't know that you could do that. So I hope that is extremely helpful to our viewing audience, that you could price, and I know that some retailers will match your price or give you the cheaper price. If you can bring in 2 prices, they'll say, okay, well, we'll give you the cheaper of the rate or the price for the pills. So that is great to know, especially in this time when people's finances are so tight. But also, I'm sure the pharmacist gets a lot of, I would say, complaints about if a drug is too expensive. But how can a pharmacist be of help?
Well, there are a lot of manufacturers that provide coupons and discounts for their brand name drugs. Now, most of the time, it's only the brand name drugs because they are very expensive. And I don't know about now, but they used to actually, the manufacturers would send out representatives and they would give those coupons right there in the pharmacy. So a lot of times pharmacists can help you by just putting in that coupon right away, right there. Or maybe they can direct you to a website in order to find a coupon and save some money and get a discount. A lot of that also could depend on your insurance and working with your insurance company. So another way that pharmacists can help with expense is that going back to that medication therapy management. If you have medications and maybe you're on a brand name drug, because just like the drug representatives come into the pharmacy, they go into the doctor's offices and they make a case as to why their medication is better than what's currently on the market, maybe a generic substitute. So these doctors may be writing for the newest treatment or the latest treatment that they believe is superior and is best for their patient. But at the same time, if you can't afford it, you're not taking it. So it's not best for you. It's not helping you. But there are, and I honestly like the generic medications as first-line therapies. And in most cases, you do have generic medications that are first-line therapy for most disease states because they have been tested. We know how people react to them overall for the most part. We have a good map and outline of the side effects that people may experience, and they're just more familiar. So a generic substitute may be your best bet, especially in starting out new therapy. And pharmacists can help. Most times they can see and pick up on that right away. You know, have you considered this? Have you tried that? Hopefully, your doctor doesn't just start you on a brand name medication unless you've tried generics. If it's a class that has a lot of generics and you have failed them for one reason or another.
Wow, that's good information to know. And so I wanted to ask you, I'm going to share the screen again to talk about other services that pharmacists provides. So the pharmacist is one of your best friends. So as you were saying, you can talk to the pharmacist about blood pressure monitoring, making sure that you have the right cuff size. You also administer vaccines. You can provide smoking cessation counseling, cold care instructions, and as you said, medication therapy review, and also instruct patients or your clients or your customers on the proper way to take your medicines. Is there anything else that we're missing from that list that we talked about today?
I don't believe so. For a retail pharmacist, yes, this is a very comprehensive list. But I would say if you do have a medical question, don't hesitate to ask your pharmacist. They're not there to diagnose, but they can definitely give you some guidance as to what to try over the counter, or definitely make an appointment with your primary care physician, or maybe even go to an urgent care.
Wow, thank you so much for that. So I want to thank our guest today, Dr. Raymisha Gregory, a pharmacist in your local area. And I thank you for coming on TOVA Tuesday today, your TOVA Health TV channel. Is there any way they could reach you if they had any questions? Or how can they connect with you, Dr. Gregory?
They can reach out to you, and then I'll be happy to respond.
That's fair enough. So if they have any questions or they want to reconnect with you, Dr. Gregory, you can email us at contact@tovacommunityhealth.org. So I want to thank you for joining us today. If you like this episode and you found it very helpful and these resources, please make a donation to our Cash App, $TOVA Health. Again, I want to thank Dr. Raymisha Gregory for such a fantastic show today. I am really excited to share this information with our community, and I think we have a better perspective of what a pharmacist does and understand that they can provide a wealth of knowledge to you. And please do not scream and yell at them if you can't afford your medications. They can work with you to try to find better options. All right, take care. You guys have a fantastic day. Thank you.
Thank you for having me.
Thank you. Okay, I have to